41% of gay men experienced homophobia when using facilities or services.
The hardest thing was, right, I'm out on my own now. How do I be myself?
And you've no way of getting any advice, or you've no way of sort of having anyone to turn to kind of go, well, actually, Debbie, it's okay, you can. You can go and do this, it is okay, it is healthy, it is normal. Don't be worrying about it, just go ahead and be yourself, is what I wanted to hear. But what I heard was just silence.
I really kind of spent an awful lot of time in my teenage years thinking that I wanted to die. I never really thought that I could access services, just because I didn't think that my issues were even important, you know.
The research shows that the impact of staying closeted, if you like, and not being able to access either adult or peer support reduces young people's self-esteem, their self-confidence. They tend to leave school earlier. They're at a much, much higher risk of self-harm and suicide.
It's personal to me because when my 15-year-old daughter died, she left a note, and in the note it states that she was unsure of her sexuality and that she had feelings for another girl, and that caused her great stress, you know, and it was the theme of her note. So that was something that broke my heart, that she felt that she couldn't be herself. It wouldn't have mattered to us, but she felt she couldn't come out.
People who are LGB&T prefer to access an LGB&T specific service. Some people are happy to access mainstream services, but the concern is around a fear of a homophobic or transphobic response.
The stigma in the rural areas is very high, and unfortunately that leaves anyone from LGBT community unable to come forward and seek help.
You are probably dealing with clients who are LGB&T all the time. They may not feel that they can disclose this to you. And if a client is not disclosing part of their identity or part of who they are, or sharing part of their life with you, and you're trying to resolve their issues, that may act as a barrier.
I wouldn't have went anywhere near the primary mental health care team at home or anything for any help with my sexuality, just because I don't trust them. I didn't trust them.
My school counsellor was our RE teacher, you know, in a Catholic school. She was an ex-nun, and I didn't feel for once that I could ever go talk to her. I mean, don't be ridiculous.
A lot of people don't know about it and don't know how to sort of react or how to address she and stuff like that. They just go with what they think's right. And unfortunately, 99% of the time it's completely wrong.
The issue with gay people, it's very much oversimplified. So it is, people think just by saying, okay, I don't have a problem with you, I accept you, then all the problems have gone away. No, there's a whole array of problems within that.
You went to a doctor and the doctor just didn't understand you. You know, because you were institutionalised, that's how you're gay.
He made it sound like it was a medical condition, and that was the sole reason why you were in hospital and why you put yourself there, and why you were so unhappy. And that's why you're depressed.
I think it's important that that people can access someone that they feel will not be judgmental around their sexuality. Having said that, the majority of LGBT people will be going to their local GP, or maybe attending a psychiatrist, or their CAMS team, or whatever, and that they will access mainstream services. What they need to know is that, and I think it needs to be demonstrable, that there are posters on the wall that says it is okay to be lesbian or gay here.
If I'm an LGBT person and I access a service, I hope that I'm not going to experience transphobia, and I hope that I'm not going to experience homophobia. So I'm presuming that the service is going to be, that I'm going to be able to access it. But if I'm accessing mental health services from a mental health professional, a counsellor, a teacher, a youth worker, or a community worker, what is there is intrinsic to their training that gives them an awareness of LGBT&T issues? Unfortunately, the answer currently is very little. It may come up organically, or it may be that a particular lecturer or professional who's training them will bring up the issue. But some people could go through the training and never touch on LGBT&T issues. When we look at the health inequality in terms of mental health and see the LGBT and or T people are more likely to experience poorer mental health and those outcomes, and therefore more likely to access those services, why is it not intrinsic to the training for those professionals? Now I can access a counsellor who will have the best of intentions and will ad hoc try and support me, but has absolutely no awareness about what the issues for me as a gay person are.
So we're very keen to make sure that the services we provide are designed in such a way that they're gay friendly, that people will feel safe and comfortable speaking to their GP, their social worker, or any frontline service provider about issues that are affecting them that might be impacted by their sexual orientation.